Plastic surgery. It's a phrase that almost immediately brings to mind images of celebrities, lip fillers, facelifts, and cosmetic enhancements. Today, the industry is worth tens of billions of dollars, and millions of cosmetic procedures are performed every year across the world. But what if I told you that for more than 2,000 years, plastic surgery had almost nothing to do with beauty? In fact, the origins of plastic surgery are rooted not in vanity, but in survival. It was developed to repair devastating injuries, restore lost body parts, and help people reclaim both function and dignity after disease, punishment, or war. So how did one of medicine's oldest reconstructive specialties become so closely associated with aesthetic enhancement? And what can that transformation tell us about the way modern society views beauty? To answer those questions, we first have to travel back more than 2,500 years. Chapter 1: The Birth of Plastic Surgery. The history of plastic surgery begins in ancient India around 600 BC with a physician named Sushruta, who was often referred to as the father of plastic surgery. At that time, nose amputation was a common punishment for crimes such as theft, adultery, and other offenses. In warfare, soldiers also frequently lost parts of their faces in combat. Losing a nose was far more than a cosmetic injury. The nose plays an important role in breathing, filtering air, supporting speech, and contributing to normal facial structure. Beyond these physical functions, facial disfigurement often carried severe social consequences. Individuals with missing facial features could be publicly identified, stigmatized, and excluded from society. Faced with these challenges, Sushruta developed an innovative surgical technique that involved taking a flap of skin from a patient's forehead while leaving it attached to its blood supply and carefully rotating it downward to reconstruct a new nose. Remarkably, this forehead flap technique proved so effective that modern reconstructive surgeons still perform refined versions of the same operation today. Although medical technology has advanced dramatically over the past 2.5 millennia, the basic principle behind Sushruta's procedure remains one of the foundations of reconstructive facial surgery. Chapter 2: The Spread of Reconstructive Surgery. As civilizations grew, knowledge of surgery gradually spread beyond India. Physicians in ancient Greece and Rome expanded techniques for treating burns, repairing wounds, and reconstructing damaged tissue. Surgeons, such as Celsus, documented the use of skin flaps to repair facial injuries, while Galen contributed to the understanding of wound healing and surgical care. During the Renaissance, European surgeons continued to improve reconstructive procedures. Italian surgeon Gaspero Tagliagozzi became particularly well known during the 16th century for developing methods to reconstruct noses using skin taken from the upper arm. Although these procedures were extremely difficult and often required months of recovery, they demonstrated an important principle. Human tissue could be moved, reshaped, and used to restore damaged anatomy. Throughout all of these centuries, however, the purpose of plastic surgery remained essentially unchanged. Surgeons were not trying to improve healthy people's appearance. They were treating trauma, disease, birth defects, and severe facial injuries. Chapter 3: War Changed Everything. For centuries, plastic surgery advanced slowly. Then, in the early 20th century, the world experienced something unprecedented. World War I introduced weapons capable of causing catastrophic injuries on a massive scale. Machine guns, artillery shells, grenades, and trench warfare left thousands of soldiers alive, but severely disfigured. And because soldiers often raised their heads above the trenches, their faces were especially vulnerable to bullets and flying pieces of shrapnel. Many returned from battle missing their jaws, noses, cheeks, eyelids, or large portions of their faces. Some could no longer eat normally. Others struggled to speak. Some were unable to close their eyes or breathe properly. These injuries demanded entirely new medical and artistic solutions. One of the surgeons who answered that question was Sir Harold Gillies, who was widely regarded as one of the founders of modern plastic surgery. Gillies and his medical team developed new methods for rebuilding damaged faces with tissue taken from other parts of the body. One of their most important innovations was the tube pedicle flap. In this technique, a section of skin remained connected to its original blood supply where it was gradually transferred to the injured area. This helped reduce infection and gave the transplanted tissue a better chance of surviving. However, surgery cannot completely repair every injury. Some soldiers had lost so much tissue that even the most advanced operations of the time could not fully reconstruct their faces. For these men, another important figure offered a different solution. His name was Francis Derwent Wood. Wood was not originally a surgeon. He was a British sculptor who served with the Royal Army Medical Corps during World War I. After seeing soldiers with severe facial injuries, Wood used his artistic skills to create custom-made facial prosthetics. At the 3rd London General Hospital, he established a specialized workshop known as the Masks for Facial Disfigurement Department, and sometimes the workshop was informally referred to as the Tin Noses Shop. Wood carefully studied each soldier's injury and used photographs taken before the war whenever they were available. He then sculpted a replacement for the missing portion of the man's face. These lightweight masks were commonly made from thin metal and painted to resemble the soldier's natural skin. They could replace the appearance of a missing nose, cheek, eye, or other facial feature. Some were held in place by glasses, while others were secured around the head. These masks did not restore movement, sensation, or physical function. They were also not substitutes for surgical treatment. However, they helped conceal injuries that surgery could not repair and allowed some soldiers to feel more comfortable appearing in public. His work demonstrated that recovery involved more than keeping a patient alive. It also involved identity, confidence, and the ability to return to society. Sir Harold Gillies and Francis Derwent Wood approached the same crisis from different directions. Gillies used surgery to rebuild living tissue and restore physical function. Wood used sculpture and prosthetics to create the appearance of facial features that could not yet be surgically reconstructed. Together, their work showed that treating facial disfigurement required both medical skill and an understanding of the emotional consequences of injury. The methods developed during World War I and later improved during World War II helped establish the foundation of modern reconstructive surgery and facial prosthetics. It is important to remember that these treatments were not created to make patients appear younger or to help healthy people meet beauty standards. They were created for people who had suffered life-changing injuries. Their purpose was to restore the ability to eat, breathe, speak, and blink whenever possible. And when full physical reconstruction was impossible, people like Francis Derwent Wood attempted to restore something equally important: a person's sense of identity, confidence, and dignity. Chapter 4: When Reconstruction Became Cosmetic. By the end of World War II, plastic surgeons had accumulated decades of experience repairing some of the most severe injuries medicine had ever encountered. The techniques were becoming increasingly sophisticated, and at the same time, medicine itself was rapidly improving. The introduction of safer anesthesia, antibiotics, sterile surgical techniques, and improved hospital care dramatically reduced the risks associated with surgery. As reconstructive surgery became safer and more predictable, physicians began asking a different question. If these techniques could restore damaged faces, could they also improve healthy ones? During the second half of the 20th century, cosmetic procedures such as rhinoplasty, facelifts, breast augmentation, and eyelid surgery became increasingly common. Unlike reconstructive surgery, which seeks to restore what has been lost through injury or disease, cosmetic surgery is elective and focuses on changing features that are already healthy. The medical techniques were largely the same. The goals, however, had changed. Chapter 5: The Modern Era of Aesthetic Surgery. Beginning in the late 20th century and accelerating into the 21st century, cosmetic surgery experienced unprecedented growth. Several factors contributed to this shift. Advances in technology made procedures safer, faster, and more accessible. Television, magazines, and later social media dramatically increased public exposure to beauty standards that were once limited to celebrities and models. Today, millions of people are exposed every day to carefully edited photographs, digital filters, and highly curated images of appearance. Cosmetic surgery now exists alongside non-surgical procedures such as Botox and dermal fillers, laser treatments, and skin resurfacing. For many individuals, these procedures provide meaningful improvements in confidence or help address features they have long wished to change. At the same time, some researchers and clinicians have raised concerns about the increasing pressure to pursue an ever-changing ideal of beauty. And as aesthetic medicine has become more accessible, questions have emerged about where healthy self-improvement ends and the pursuit of perfection begins.